So what is scarring like after gynecomastia surgery? So there's two types of scarring. There's the scarring on the skin where the incisions are made, or this scarring under the skin where the procedure is done and due to surgical trauma. So the scarring on the skin depends on the method used. Most commonly, the scar is just under the areola border. For most patients, it's not obvious they've had surgery, but due to individual or genetic reasons, some people have thickening of the scars, and that may be obvious. But luckily, most patients heal well and the scar doesn't catch the eye. There are other incisions, depending on your grade, that require liposuction. A tiny one in the armpit crease. Some surgeons do on the side. I prefer just here when possible. Or you can have a scar that goes all the way around the areola. These are when you need usually a nipple lift. Sometimes you have a grade 4 surgery and you will need double incision mastectomy, double mastectomy, so that will leave a scar across the chest. Sometimes you can go underarm to address the excess skin that you have on the sides. Then there are others that are less commonly used these days, like an inverted T or a vertical, what we also call lollipop, that goes around the areola. And these are less used these days. In my practice, most commonly for grade 4 is just across the chest. And sometimes grade 3, or if someone has got loose skin, we may use a circumareolar scarring. Then there's a scarring under the skin, which is because of maybe liposuction or procedures you've had, like skin tightening, energy devices, or through the excision of the gland. So from liposuction, you may get strands of fibrosis along the cannula lines. Again, these are temporary and they go away over time. You may get lumps in different parts of the chest. These are because of fibrosis, hardening of tissue. But initially, there's swelling, a type of scarring, or panniculitis, inflammation of fatty tissue under the skin, gives you a bit of hardening of the chest, which can be a bit tender. Massaging helps this. Needs lymphatic drainage to help the drainage of fluid. There's also another type of, not scarring, but inflammation. Due to inflammation, you may get a string of band that goes under, from usually around the nipple area, going all the way down the tummy. This is Mondo's disease, also known as Mondo's string. This is because of inflammation of a superficial vein, and it's temporary, subsides over weeks or months. If you're worried about your scarring after your surgery, get in touch with our office and we will assess you.